Bismillahirrahmanirrahim. Today I'll discuss the shock. This is a second lecture. In the first lecture, I have discussed the hypovolaemic shock. In this lecture, I will discuss other types of the shock. So, other type of shock according to Henshaw and Cox classification. I'll discuss today the distributive. The other causes of shock, and the first one is the distributive shock. As in hypovolemic shock, there is an insufficient intravascular volume of blood. This form of relative hypovolemia is the result of dilation of blood vessel which diminish systemic vascular resistance. Distributive shock or vasodilatory shock is a medical emergency where body cannot get enough blood to heart, brain and kidney. This happens because blood vessels are extremely dilated, flaccid or relaxed, which bring down blood pressure and cut down on how much blood can get organ. Often these small blood vessels or capillaries are leaky in distributive shock, resulting in some fluid loss from the circulation. Septic shock caused by an overwhelming systemic infection resulting in vasodilation leading to hypotension. This can occur through the action of bacterial lipopolysaccharide called endotoxin. Septic shock is a serious medical condition that can occur when an infection in body causes extremely low blood pressure and organ failure due to sepsis. Septic shock is life-threatening and requires immediate medical treatment. The mortality associated with septic shock is presently very high, estimated at 50% to 70%. Anaphylactic shock caused by a severe anaphylactic reaction to an allergen, antigen, drug or foreign protein, causing the release of histamine, which cause widespread vasodilation leading to hypotension and increased capillary permeability. In children, anaphylaxis is usually caused by shellfish, peanut fish, tree nut, milk, egg, and etc. In adults, apart from allergens that cause anaphylaxis in children, adults usually respond allergically to sting from bees, wasps, yellow jackets, fire ant and hornet, and certain medication like over-the-counter pain reliever, intravenous medication, and certain antibiotics. In certain cases, too much exercise in the form of aerobic or jogging can also send the body into shock. Environmental factors like extreme hot or cold weather, dust or direct sunlight can also trigger the body to release chemical causing anaphylaxis. Neurogenic shock. Neurogenic shock is the rarest form of shock. It is caused by trauma to the spinal cord, resulting in sudden loss of autonomic and motor reflex below the injury level. Without stimulation by sympathetic nervous system, the vessel wall relaxes uncontrollably, resulting in a sudden decrease in peripheral vascular resistance, leading to vasodilation and hypotension. Some neurogenic factors that can cause loss of vasomotor tone include the following. Deep general anesthesia often depresses the vasomotor center enough to cause vasomotor paralysis, which resulting neurogenic shock. With resulting neurogenic shock, spinal anesthesia, especially when this extends all the way up the spinal cord, block the sympathetic nervous outflow from the nervous system and can be a potent cause of neurogenic shock. Brain damage is often a cause of vasomotor paralysis. Many patients who have had brain concussion or contusion of the basal region of the brain deep profound neurogenic shock. Also, even through brain ischemia for a few minutes also always cause extreme vasomotor stimulation. Prolonged ischemia lasting longer than 5 to 10 minutes can cause the opposite effect, total inactivation of the vasomotor neuron in the brain stem with consequent development of severe neurogenic shock. Obstructive shock. In this situation, the flow of blood is obstructed, which impedes circulation and can result in circulatory arrest. Several conditions result in this form of shock. These are atrial myxoma. An atrial myxoma is a non-cancerous tumor in the upper left or right side of the heart. It most often grows on the wall that separates the two sides of the heart. This wall is called the atrial septum. They can occur in other intracardiac side as well. It is a space-occupying tumor, reduce the size of cardiac chamber and reduce in blood volume return to the heart during diastole and reduce systolic volume lead to shock. Tension pneumothorax. Through increased intrathoracic pressure, blood flow to the heart is prevented. Venous return. Pneumothorax means accumulation of air in the chest cavity, which compress the heart and cause collapse of the lung and cause decreased venous return, which leads to decreased output of the heart and lead to shock. Massive pulmonary embolism. Massive pulmonary embolism is the result of a thromboembolic incident in the blood vessel of the lung and hinder the return of blood to the heart. Thrombus occur in the DVT or thrombus occur in the leg veins when it is detached, transported by the blood into the heart and from the heart to the lung, where it stuck in the blood vessels and cause obstruction to the vessel and prevent return of blood from the lung to the heart, and in this way cause low cardiac output and lead to shock. Cardiac tamponade, in which fluid in the pericardium prevent inflow of blood into the heart. Venous return. Constructive pericarditis, in which the pericardium shrink and harden, is similar in presentation. Here this is the normal heart and there is no fluid in the pericardium. These are double wall chamber which surround the heart, and when fluid, blood or pus accumulate in this chamber, cause compression of the heart and prevent the heart from pumping, leading to shock. Another cause is calcification of the pericardium, which harden the pericardium and prevent cardiac beating or prevent heart from beating or from pumping of blood and lead to shock. Aortic stenosis hinder circulation by obstructing the ventricular outflow tract. Here this is the normal aortic wall and its normal orifice or opening, and when the aortic wall is normally closed. Here in this case the aortic wall opening is reduced in size, and this reduction in size is called aortic wall stenosis. This is the open aortic wall stenosis. Due to this stenosis, the flow from the ventricle to the aorta is